There we go. We're recording the session today. So welcome everyone. Thank you to Jenny and Lisa from the Canadian Medication Appropriateness and Deprescribing Network. I am Stephanie. I'm representing Healthy Aging Alberta and Core Alberta Platform. So we're hosting this session today with our guests here. We will be recording the session and I will send out the recording afterwards. So if you want to, I know Lisa's going to share some very valuable information. That'll be a lot of information we'll probably want to keep track of. So you'll be able to watch it again, or if there's somebody that you know wants to see this and they missed out, you can share it along. So we will share the recording afterwards. Lisa has welcomed questions throughout the presentation, so you're welcome to ask questions in the chat, and Jenny and I will moderate that, as well as we'll have some question time at the end here. And before we get going, I'm going to first do a land acknowledgement here for us. So in the spirit of our journey to promote reconciliation, we'd like to honor the truth of the shared history and acknowledge the many First Nations, Métis and Inuit who have lived in and cared for these lands for generations. We're grateful for the traditional knowledge keepers and elders who are still with us today, and for those who have gone before us. And myself, I'm tuning in from Mohkinstsis, also known as Calgary, which is in the Treaty 7 territories, and the traditional lands of the Blackfoot Confederacy, including the Kainai, Piikani, and Siksika nations, the Yahe Nakota, including the Goodstoney, Chiniki, and Bearspaw nations, and the Tsuut'ina, as well as Métis Regions 5 and 6. And I know our colleagues are tuning in from all other places across Turtle Island. So I'd also like to recognize the nations that are the nations and regions and treaties that they're sitting on. Okay, I will introduce our guest. So Lisa Tate is a clinical assistant lecturer at the Faculty of Pharmacy and Pharmaceutical Sciences at the University of Alberta. She's worked as a clinical pharmacist in both inpatient and outpatient settings, including 9 years at the Geriatric Evaluation and Management Clinic in St. Albert and Sturgeon Primary Care Network. She has an interest in deprescribing as a tool to rationalize and optimize drug therapy. So what we're hoping from this session today is that you're going to learn what medication overload means and why it matters, why seniors are at higher risk from medication-related harm, the practical strategies to prevent medication harm in your province, and key medication safety resources for the older adults, the caregivers, and the service providers. And I'll pass it over to you, Lisa.
Well, thank you for that kind introduction. I have to say, I was thrilled to be invited to participate in giving these talks because before all of this, I was already very passionate about the role of deprescribing in healthcare. And I can honestly say that some of my most professionally satisfying work has been stopping medications that people no longer need, simplifying people's medication regimens, and making people feel empowered to be participants in rationalizing their medications. Certainly, medications can have profound benefits for people's lives and health, but they also are, of course, not without risk. So today we're going to be talking about that balance between the harms and benefits of medications. We're going to be providing you as patients and caregivers with some concrete action plans about what you can do to make sure your medications are optimal, and to be a participant in that regular process of a reevaluation. So by the end of the presentation, I want you to feel more informed about safe medication use and comfortable discussing these issues with friends, family, and of course, most importantly, with your healthcare provider. As we go through the presentation, you may come up with questions. I invite you to share them as we go. The one thing I can't do is provide you personal health advice. These are complex issues, and certainly discussing them with your healthcare provider is the right venue to go. But I, of course, happy to discuss general questions as we go along. So today we're going to try and answer a few different questions. One of them is, why are we more sensitive to the effects of medications as we age? We want to identify situations where the risks may outweigh the potential benefits and how to determine that, and to talk about how we can all work together to prevent these harmful effects, which are increasingly becoming recognized. And of course, as I mentioned, there'll be some points in the presentation where I'd love to hear from you. So you can type in the chat, unmute yourself, let me know what's on your mind, and I invite this to be a discussion. Okay, so this presentation is made possible through financial support from Health Canada. That said, the views expressed in this talk today don't necessarily represent the views of Health Canada. I have no conflicts to declare. I'm just a pharmacist who likes to take care of seniors and participate in the review process. We've already had a land acknowledgement. Thank you so much for that. Of course, just as there's people joining us from across the country today, Caden's many members and partners live in dozens of communities across Canada and are located on the traditional lands and treaty territories of numerous First Nations peoples, Inuit and Métis peoples. I myself am located in Treaty 6 territory. I'm glad I included a picture that has the whole country here. So this is the traditional territory of the Cree, Dene, Nakota Sioux, Anishinaabe, and Blackfoot nations. And I acknowledge the deep connections these nations hold to the land and recognize my responsibility in supporting reconciliation and respecting their rights and heritage. And Caden itself has been engaging in reflection on how we can meaningfully contribute to reconciliation. In fact, the network started by acknowledging its shortcomings since the founding of Caden in 2016. Relationships and engagement with Indigenous peoples is a priority for Caden, and the next step was bringing a working group together comprising Indigenous peoples and allies to develop a 5-year action plan to decolonize and indigenize the network. And so with that action is committing to building strong relationships with Indigenous communities in Canada, partnering with Indigenous communities to recognize that priorities relating to medications really are influenced by Indigenous ways of knowing and doing and being in the community. So why do we take medications in the first place? Why do you take medications in the first place? Does anyone have any comments on the purpose, not necessarily the medical condition that it's for, but why do we take medications?
And you're welcome to unmute yourself or type in the chat and we can relay those answers.
I'll start you off with the big concepts that inform why we prescribe medications in the first place. Sometimes medications can cure disease entirely. So if we think about, you get a pneumonia, you're admitted to hospital, we're able to completely cure and eradicate disease with some medications. That said, we also use medications to manage chronic conditions. So as we get older, we're more prone to chronic conditions like diabetes, lung problems, heart disease, arthritis. I'm sure many of you can identify with some of these things. And really, we can see medications as one of the tools in our toolbox to help control those conditions, along with many other strategies. And I do see set to reduce pain. What else is in the chat? Yep, to battle
or counteract health issues.
Yep. And to maintain our health and stabilize it to complement diet. I love this. And this is exactly my point. Medications are just one tool in the toolbox, and they're certainly not a panacea. Health maintenance and prevention is another thing that I'd like to point to, is that we're not always just treating existing disease. We know that things like treating high blood pressure can help prevent the consequences. So prevent strokes, prevent heart attacks. It's not just managing those things after they happen. And then, of course, as someone mentioned, to reduce or eliminate symptoms of disease. We take over-the-counter medications to relieve pain and fever and symptoms of many diseases. So again, sometimes we can cure diseases, sometimes we can manage chronic disease, sometimes it's about how you feel, symptom relief. But again, when we think about prolonging life expectancy, we know that certain medications can do that as well. If I think of this in its entirety, though, what is the point? Our ultimate goal, of course, is to to improve people's quality of life, and whatever that looks like for you. And as you age, the definition of quality of life, of what's important to you, your priorities can change from when you're 50 to 60 to 70. And so reassessing medications as we go to make sure that they're still aligning with what your priorities are is key in the process here. That said, I want to be clear that this presentation is not a call to stop taking your medications. Every person is different, and deprescribing isn't right for every medication or for every person. So although we'll be shining a spotlight on the harm that medications can cause, there's also profound benefits that can come from medications. So if there's one takeaway I'd like to leave you with, it's that medications need to be reevaluated on an ongoing basis to decide if they should continue, stop, change. And this must be done in partnership with a healthcare professional to ensure that the medications you're taking are needed and beneficial, and to, again, on the flip side, assess whether they might be causing harm or could in the future. While the fuss about medications, I think we all know the term side effects, and we of course are, again, aware of the benefits, but know that side effects is something that worries people. One of the top health concerns for older adults in Canada is side effects. There's been phone surveys to say, what are your concerns? And people worry about this. And healthcare professionals, just like patients, are increasingly concerned about even undetected side effects, and keeping our eyeballs on making sure that we're attentive to this and picking up when harms start to emerge. So today we'll explore why everyone, not just older adults, on medication regimens need to have those regimens reviewed on a regular basis. Because what was making sense at working at 50 might not be right at 70 or 80. Some of you might have seen this before, but I'm going to get you to take a stab at this. What percentage of older adults, so people over 65 living in the community, take 5 or more prescription medications? So just prescription medications, not thinking about vitamins or supplements. So what do you think if you had to estimate the percentage, 5 or more? $70, over 50? Okay. So 62%, wow. Smarty Pants is in the audience here who almost got it exactly right. What about 10 or more prescription medications? It's less here, but still a quarter of the population. Imagine 10 prescription bottles lined up on your counter. Again, plus or minus, supplements or over-the-counter medications. So it's a big number. When we go into people over age 85, that number jumps. So 36% of people over 85 are taking 10 or more medications. So the burden of the issue is certainly clear when we think about those statistics. That said, those are averages, right? So when we think about the 7.3 million Canadians who are over age 65, it's a diverse group of people. The vast majority live independently in the community, but of course, there's also people in different forms of care facilities. But when we think about older adults, even those with chronic conditions, 56% report that they feel like they're in good health. So this is what we want to maintain. This is the whole purpose of healthcare, is to maintain health and wellness. So 75 to 80% of people over 65 do live with a chronic condition, but they feel that they're in good health, more than half. That said, a quarter of people over 65 live with frailty. This is a term that's being talked about much more in the care of older adults, which is a state of health where the overall well-being and ability to function independently is reduced, and where the person is more vulnerable to health deterioration. And so not everyone who ages becomes frail, but of course there is a tie between the two. The two are not the same, though. Many people are living well into their 80s without frailty. So there's also obviously tons of ethnic and cultural diversity among the Canadian population and among Canadian seniors. And with this comes different different ways of thinking about health and medications. And each culture, there may be cultural associations with taking medications. And depending on the context, that may result in increased or reduced amounts of medications, number of medications used, and sort of willingness and interest in using medications. And I think that we need to think about that cultural context and how it influences people's views on their medications. So what's the connection between aging and sensitivity to medications? Why does it change as we age? Fortunately, life expectancy is now longer than it was 100 years ago or even 50 years ago. And certainly that's in great part thanks to advancements in medication and medicine in general. But as we get older and there's more people in our population getting older, there's more chronic disease, which leads to down the line tending to take more and more medications. But of course, although there's benefits of those things, the more medications you're on, the more risk you have of having a harmful side effect. And as I mentioned earlier, what was good at 10 years ago may not have the same benefits and may in fact carry some harms. What happens in our bodies as we get older that results in this increased sensitivity to medications? So certainly the brain becomes more sensitive to the effect of drugs. So that might cause confusion, dizziness, memory issues, fatigue. So the brain is more sensitive to those nervous system effects of medications. Medications, we have more difficulty clearing medications from our bodies than we did at one point. So if we think about our body composition, I'm sure many of us can identify with this. Less muscle and more body fat means the distribution of drugs within our body is different. And then lastly, the way our body processes medications and eliminates them is typically for most drugs through the liver and the kidneys. And the liver and kidney function reduces as we age. And this isn't just restricted to people who, have identified kidney disease, just function decreases over time. So among the population, we've already talked about the fact that people over 65 are more sensitive to the risks of medication, but it's not the only group that is at increased risk for harm. People with multiple chronic conditions are more vulnerable to side effects. So, I mentioned kidney and liver dysfunction, also just multiple chronic conditions means that we're on drugs that could have interactions. So certainly the more medical conditions you have, the more at risk you are of experiencing harm from drugs. And then lastly, a category that might be surprising to some of you is that women are more susceptible to harmful effects of medication. And that's just physiologic, biologic processes. And I'm going to dig into that a little bit more in the next slide. What is it about women? So I mentioned, of course, just physiology and biology. But the other thing is women do actually suffer from more chronic conditions than men and are therefore often prescribed more medications. This also can be related to seeking care, that women are more likely to seek medical care and consult their doctors more often than men. So when we think about what is the definition of too many medications, it's going to be different for each person. You might have heard this term, medication overload. And in medical terms, we call this polypharmacy. So poly, many, lots of medications. And for some people, it can feel like this picture, just a mountain of confusing pill bottles to manage. And things tend to get added and added and added and over time. And where's the point where we need to start reducing? So a combination of pills can be a good thing, but the complexity lends itself to potentially it being a bad thing. So they're at higher risk when there's more medications. Why? What's risky about it? So our science shows us that medication overload or polypharmacy can increase the risk of falls and fractures. So when we think of hospitalizations for injuries in seniors, by far, they're most often due to falls. And I think we've all, think about that senior shoveling his walkway and ending up in the hospital for months after breaking a hip. So you might be thinking, okay, well, what does that have to do with medications though? What's the connection between falls and medications? Well, as we talked about earlier, the brain becoming more sensitive to drugs. So that drowsiness, that loss of balance, the confusion, all of those things can sort of pile on and increase the risk of falls. Of course, it's not only medications. Our muscle strength might be decreasing, our balance might be impaired for other reasons. So medications are one piece of the puzzle here. Memory problems. Certainly, we know there's lots of medications that can interfere with attention, memory, language, planning and executing tasks, or other cognitive processes. Sometimes those effects are temporary, go away with the medication being stopped, but there can be long-term effects of cumulative effects over the years of these medications. Drug interactions. So there's a couple different ways drug interactions can go, kind of opposite directions, actually. Sometimes interactions can sort of magnify the harmful effects. For example, if two drugs together that impair thinking and memory, sort of 1 + 1 can equal 4, in terms of the magnitude of the impairment that might be caused by the medications. That said, sometimes drug interactions are the opposite. One cancels out the other or reduces the benefit of that medication. So it's a complex interplay that really does require a conversation with your healthcare provider to suss out whether this is happening for you. And if it is, what's the direction of the problem and what we can do about it. That said, I know sometimes people plug all their medications into, a search engine of some sort on the internet and think, oh, it says there's a drug interaction, this must be bad. However, I do want to flag the fact that not all drug interactions are bad, actually. For example, if we think about people who have high blood pressure, often they're on more than one drug for that because we need more than one drug to get the blood pressure to our target. If you put those medications into the computer, it might say, there's a drug interaction between these two. But that's, again, not always bad. Sometimes that's the point. We're trying to optimize the benefit of one medication by adding another. So again, the complexity of this means it's something that needs to be addressed in concert with your healthcare providers. And then hospitalizations, certainly a concerning thing, which we're going to get into in the next slide. So we know this is a big number. 6 to 12% of hospitalizations in older adults relate to medications. So 1 in 10 people, in older adults in the emergency room, it may be due to medications. A lot of these things are avoidable. And in addition to that, I think there's even more problems that go undetected. So it's not picked up on. And certainly as a pharmacist in an inpatient setting, when I worked in the hospital, I always felt like it was my job to assume a drug was contributing until I could rule it out. So certainly we work together in the healthcare team to identify when drugs could be a contributor to the health problem that we're seeing. So when we think back to that picture of that mountain of pills on the table for those two, the couple shown in the image there, of course, the more medications we have to take, the easier it is to make a mistake, to double up, to as the complexity increases and you use these pill containers, things to try and organize, but of course the risk of an unintentional error goes up with the number of medications as well. And again, earlier when we were talking about those statistics about people taking over 5 medications per day, over 10, that's just prescription medications, which I can tell you, working with seniors, there's often many more different types of pills that are in the mix there. More than 3/4 of Canadians report using at least one complementary alternative therapy sometime in their lives, based on a Fraser Institute report. And that may be natural health products, so vitamins, supplements, herbal products, which often people think or have a perception that natural things mean no harm, no risk, but there certainly can be, and that's why it's essential for your healthcare providers to be aware of these non-prescription medications that you're taking. Traditional medicines, which incorporate plant, animal, mineral-based medicine, including spiritual therapies, There's such a myriad of traditional medicines, which I think we're getting better at inviting our patients to talk to us about the traditional medicines that we're using, but we really need to make sure that there is an open communication so that people can share with us the traditional medicines they're using, and we can consider that in the whole big picture of how people want their healthcare to look. Then, of course, over-the-counter medications is another big one. Tylenol, Advil, Gravol, we've all heard of all of these. As an example of when we were talking about the brain becoming more sensitive to medications, Gravol and Benadryl are a couple of those medications that certainly can affect thinking and cognition. So over the counter, but not without risk. Additionally, we think about other substances, the effects of alcohol, cannabis, and other recreational drugs. The use of cannabis-containing products has really increased in the last decade or so, and can increase the risk of harm. So we need to, again, make sure we have an open dialogue about other substances that a person may be using for recreational purposes, for medical purposes. We want people to know that this is not insignificant and important to share with your healthcare provider. When we think of the effects of alcohol, this isn't just for older adults. There's, growing attention in the media about the negative effects of alcohol, headaches, drowsiness, fainting, loss of coordination, heart problems. We're increasingly appreciating the risk of alcohol in cancer risk as well. Just going to check on the chat here. Once one takes pills, their effects stop working and one increases the dosage. Oh, okay, I see. Thank you for your comment, Preet. Certainly there are medications, and what you're speaking of is tolerance. Not every drug creates tolerance in the body. So when I say tolerance, it means needing more to achieve the same effect over time as you take a medication. And certainly there are medications like that. And in terms of pain medicines, I mean, we hear about this in the media. Certainly opioids are an example of that, where over time, you need more and more to achieve the same effect. Another one that's not uncommon in the population in older adults as well as sleeping pills. That's another one that you had tolerance and you need more and more. What one pill used to get you to sleep, now it's 1.5. We're going to talk a little bit more about sleeping pills a bit later on. Okay, so how do you know what medications are risky? So, and what do we mean by risky? So it's not just the number. You can be on 2 medications and still have something that's risky for you. So what we mean by that is a drug where the potential risks outweigh the benefits. And oftentimes there's something safer we could be using that is equally or even more effective. So again, it's not just about minimizing harm, which is critical, but it's also, we want you to be getting something out of this. We want to make sure that we're reaching the goals and endpoints that you have in mind for your own health. Okay, sleeping pills. This is a big one. And there's so many risks, and some of them are outlined in this slide that can slow your reaction time. So when do we think of that as being critical? Driving certainly is a factor there. Planning, initiating tasks, keeping up with the day-to-day certainly can be impaired. Memory and concentration, attention span, ability to concentrate. Impairment of coordination and movement, which again can, affect falls. And again, another big thing that we need to think about is driving. Daytime drowsiness, that hangover effect that some people can feel from medications and can impact your daily activities. So I think this is very recognized issue. And again, when you want to look at how much are we really benefiting from sleeping pills, and the research tells us 14 minutes. It may help people fall asleep 14 minutes faster. And when we look at all of these risks that it comes with, I think that it really causes us to pause and think about, is there a better way to be managing sleep problems? And the good news is we know that there is drug-free ways of training the brain to sleep better. It takes a lot of effort. It's more work to have good sleep hygiene, for instance, than it is to take a pill, but it is infinitely safer. So, for example, some of you may have heard of something called cognitive behavioral therapy for insomnia, which is a non-medication approach that helps you train yourself to sleep. And it is officially recommended as the first-line treatment for insomnia of younger people, older people, everybody. Everybody should be doing this first. And I do want to just, oh, you have the link there. mysleepwell.ca is a Canadian-based organization where you can learn a little bit more of how to go about this. It's actually quite a structured program, cognitive behavioral therapy for sleep, but honestly can be very effective. Okay, quiz time again. So when we talk about risky medications, how many Canadians over age 65, percentage-wise, do you think takes a risky medication? Yes, thank you for your comment there, Chris, about cognitive behavioral therapy being an excellent treatment modality for many things, for anxiety, for depression, insomnia, many things. So 35, 60, 85. Oh, thank you, Jenny, for posting that. Sleep well. Okay, here's what I got for you. So 38% of men, 48% of women. And again, when we think about, well, why is it higher for women? It's for all the same reasons we talked about earlier. Women seek care for medical conditions more often than men. They live longer. They tend to more readily, again, see their doctor, for instance, more readily, which leads to more frequently being diagnosed with chronic conditions. Okay, so I think some of you may think, well, why are doctors prescribing risky medications? And there can be a number of factors behind this. One of them is sometimes medications get continued from a much younger age, and somebody's been stabilized on a medication for 20 years, but we may have had a ton of advancements in medicine over those 20 years where we now have better drugs, or what made sense again at a younger age does not anymore. So when we think about the cost to our system, it's very costly for society as a whole. So it's not just paying for the cost of the drug, but also the healthcare costs that comes from hospitalizations, that come from complications relating to risky medications. So $1 billion per year is a shocking number, but another impetus for us to do those medication reviews and try and get people off of these risky medications. Increasingly, when we think of other harms of medications, we think about the environmental impact of all the things we do, whether it's our grocery shopping and whether we're using plastic bags or the medications that we take. So greenhouse emissions and global warming, that the manufacture of all sorts of products, including medications, contributes a significant amount to Canada's greenhouse gas emissions related to healthcare. So the healthcare sector is responsible for about 5% of greenhouse gas emissions in Canada, actually. And medications of that 5%, 25% medications caused. I was surprised by this number myself. So it was a bit of a wake-up call for me. So we even think about things like soil and water contamination. I think we've all heard the news reports of drugs being detected in wastewater, for instance. So impact on biodiversity, water and soil contamination. And so this is another factor for us to consider. Let's take a pause and consider a story of medication overload. So we're going to talk about Fiona, who's 69. She's been feeling lightheaded lately, especially when she gets up in the morning. And she just feels like her energy has really been flagging. In the last month, she almost fell a couple of times. Okay, so this is scary. We know about hip fractures and the things that can happen with falls. But in addition to this, it's making her feel anxious about going out. And if we think about the social impact of that, so it's not just medical things, it's not just, okay, we have to prevent her from falling, but we know that all of us need social connection. And we know that this is a crisis in our society of lack of social connections. And if medications are not only affecting our physical health, but our social wellness, this is a big deal. It's something that we need to attend to. So when we look at her medication, she's on diabetes and blood pressure pills. What can we do? What can we do for, I think this story probably sounds pretty familiar. And we're going to move now into the practical part of the presentation where we discuss the things we can do to prevent harm from medications. Deprescribing. So deprescribing is reducing or stopping medications that might be causing harm. The goal is to maintain or improve quality of life. So this is about you. It's about the patient. It's not about us. It's about what your goals are and maximizing your quality of life. There should always be a plan in place to monitor medication and determine whether it can be reduced or stopped. Again, I keep harping on this, but really must be done in a team. And certainly, as I said, one of my favorite things to do when I was working in the geriatrics clinic. This works. Okay, great. Thanks, Preet. So how do we achieve that? Deprescribing needs to be part of prescribing. This is not a static system where we prescribe a medication and leave you on it for forever. Obviously, we need to go back. We start a blood pressure pill. We go back to our doctor's office. We measure our blood pressure. We see if it's working. We're not done then, okay? So regularly we need to reassess whether it still makes sense as our bodies age and our physiology changes. Sometimes medications can be stopped. Sometimes they should be stopped. And this doesn't mean that if you go and make an appointment with your healthcare provider, you're going to get rid of a bunch of your pills necessarily. Maybe dosages need to be tweaked. Maybe, as I said, there's a new drug on the market that might offer an improvement or a benefit or a decreased risk compared to something that you're on before. So rather than seeing this as sort of a straight line, we want to make sure that there's a continuous process of reassessment. So the medication review process can help you identify all of these things. And a big part of the medication process is asking you what the impacts of medications are having on your life, figuring out if they're still safe and appropriate. So let's return to Fiona. So she needs a review of her medications to look for opportunities for deprescribing. But what do you do? How do you go about getting that service? So step one is booking a special appointment. This is not a conversation that you tag on to your 15-minute appointment to follow up on something else. This should be a separate appointment with the express purpose of reviewing your medications. And knowing that that's the purpose of the appointment allows your healthcare provider to prepare in advance for that discussion, to look at your medications with a critical eye, to prepare the kinds of questions and the kind of subjects you'll need to talk about to determine whether there's still mostly benefit. So booking appointment for that specific reason is key. Come prepared. So ask your pharmacy to print the list of prescribed medications. That said, we'll have a list. We can always print a list of what it says in terms of what medications have been prescribed. But I think it's really important, as we said, to add all of those over-the-counter supplements, vitamins, traditional medicines. And a key part of this process isn't just to take a piece of paper with what the prescriptions say. The next step is figuring out what you're actually doing. You'd be surprised how often people are not actually taking it like it says on the bottle. Might be for very good reason that they're not taking it the way it says on the bottle. It may be that you're inadvertently not taking it, not on purpose, but you're accidentally taking it different than it is prescribed. And so a list is only good if it's accurate. So if there's medications on your list that you're actually not taking anymore, or you're taking intermittently, or you're taking differently, that's critical information for us to know to make good decisions. And then again, it's not about us, it's about you. How are the medications affecting you? Do you perceive any problems with them? Do you think that you have side effects, or do you have a symptom that's happening that you're not sure if it could be related to medications? And then, secondly, what are your goals? They may change over time. Many of us are caregivers of older adults. And certainly at one point in our lives, our goal might have been to, um, prevent another heart attack or to reduce the blood pressure. But as we age, there might be times when your priority is, I don't want to swallow so many pills every day. I want to have the energy to visit with my grandkids. So your health goals are the most important thing here, not necessarily what our goals for you are. This is a collaborative process, and you're in the driver's seat. The other thing to ask yourself when you're going into this review is, am I willing to stop these medications if that's the recommendation that's made? So you may feel like you're happy to get rid of some medications and not happy to get rid of others. So just considering for yourself before this appointment what your goals are. Be prepared with questions, and you may know the answers to some of these questions for some of your pills and not others. So you may feel like you're very well informed about your thyroid medication and you appreciate what the benefits are, but there may be something that you're like, I can't even really pronounce the name of this drug. I'm not that sure what it's for. I'm not sure if I still need it. So we want you to ask these questions of us. And again, if you're experiencing some sort of symptom or problem that you're not sure if it could be related to medication, bring that up as well. In addition to stopping medications, sometimes it's, again, just tweaking of the dose. Maybe we don't need as much as we did at one point. And then number 5 on here is possibly the most important point, and that is, we never reduce or stop a medication and then run away with no plan for follow-up. Because if it doesn't go well, if something goes off the rails and we need to go back up on the dose, if we need to restart a medication, if we need to change it to something else, there needs to be a process to see how it goes after we stop or reduce medications. So going back to Fiona, she reviewed her medications and saw that one of her new diabetes pills was actually lowering her blood pressure. So again, we had 2 medical conditions. We had diabetes and high blood pressure. And it turns out that the drug was causing harm to the other medical condition, was exacerbating a problem on the other side. So after discussion, one of those medications was stopped. And again, that critical follow-up piece to make sure, how did it go? Did the positive impact that we were hoping for happen, or do we need to reassess again? 2 weeks later, she's feeling like her old self and resumed usual activities. Interestingly, this case is so similar to one that I did in my lab with my pharmacy students just 2 weeks ago. We did a case very, very similar to this. So certainly deprescribing is something that's getting a lot of attention in health education as well. Moving on, we're running out of time here. So how do I know if someone I care about is experiencing this? So again, setting up those appointments. If you are observing memory issues or forgetfulness, if you're seeing your loved one or someone you're caring for experiencing falls, being less stable, walking from furniture piece to stabilize throughout the home, if there's trouble with thinking or cognition, trouble finding the right words, there can be medications that are contributing to that. Although I do want to emphasize that if you or someone you care about is experiencing any of those things, it's almost never just the drug, right? It's one piece of the puzzle. So there could be, changes in our physiology. It could be medications. It could be medical conditions. So drugs are just one piece of the puzzle. However, it's a changeable piece of the puzzle. We can't turn the clock back 10 years, but we certainly can stop a medication. So it's not a panacea to deprescribe medications, but again, it's something that we have agency to change. If you're feeling overwhelmed by the number of medications that you're taking, think, when was the last time I had an appointment and I reviewed everything, all of my pills with one of my healthcare providers? So think about this. Think about making that appointment. So here's just some ideas around things that we might hear from patients that should be triggering us to think about pills. So it's, I think, easy for people to say, I'm just getting older, this is normal. But we need to ensure that there's no outside sources like medications that are contributing to that. Oh, geez, I'm noticing all these bruises. I never used to bruise like this. Well, I guess I'm aging, and I guess that just happens. I'm sure it's nothing. Certainly medications can contribute to bruising. And again, um, I can't emphasize enough how much I feel that the social impacts of drug side effects need more attention. If you're having, for example, trouble holding your urine, so incontinence is something certainly that older adults manage. If this is impacting your willingness or ability to socialize, there's all kinds of downstream effects on your mental and physical health there. So it's not just about the physical side of things. Again, a lot of people feel this way and think, well, my doctor knows all the pills I'm on, my pharmacist knows, I guess I just have to take them all. And that's not necessarily the case. It might not even be reducing the number of medications you take. Sometimes people are taking medications 4, 5, 6 times a day, when we could simplify that and do it twice and not be interrupting your day to take medication. So there's a lot of strategies we can use. Being here today is probably a great start. So again, asking those questions about why I'm taking medications, making that appointment, and then maybe using this conversation as a jumping off point to talk about this in your communities, whether it be with your community of practice, if you're a healthcare provider, or with your friends and family, if you're a patient. There's resources. So you don't have to remember all these things that we've talked about today. There certainly are some tools that you can access through the deprescribingnetwork.ca. They're available in several languages. So, if there's a language barrier, that's something that can be potentially accommodated. There's articles that, you can, again, maybe discuss with your friends. If you have a seniors group, maybe this is something you want to bring forward as a topic, and you could have a tool like this. Okay, I talked a lot. There's only 10 minutes left, and I want to hear from you. What questions do you have for me? There's also, Stephanie put up a survey in the chat there, which is here on this page. So while you're thinking, in case you have any questions, I just do also want you to be aware that in addition to your feedback, we want your stories. So if you have a story in mind, so someone that you're aware of who has had harm from a medication, or if you've tried stopping, reducing medications, good outcomes, bad outcomes, we want to hear them all. People's stories matter. And I think that personal stories have a lot of impact in motivating the public to attend to this topic. Oh, network is active on Facebook, YouTube, and X. You can follow there. Is there a central database in Alberta for record? Yes. Yes, Joel, thank you for the question. There is. It's called Alberta Netcare, and pharmacies are required to upload information from the dispensing at their store into a central database. So every healthcare provider you see can access the medications that you're taking. Yes. Again, a list on a piece of paper is helpful, but it's one piece of the puzzle. Of course, confirming how you're actually using medications, ensuring that those over-the-counter natural healthcare products, those things don't show up on that central database. So those are the things we need to collect individually. Okay. Stephanie or Jenny, do you have anything to add, or?
Just thank you. That was very informative and so much information. And just a reminder to folks that we did, like I said at the beginning, we did record that. So as Lisa had gave us so much information here. I'll send out the link when it's live so you can rewatch certain bits if you want to catch up here on that, or if you have somebody in your circle that you would like to share that recording with, they can also watch that. But thank you, Lisa. That was so informative and yeah, very valuable here.
I'm happy to stay on for a bit after the recording ends, if anyone would just rather talk after the recording has ended.